Translation is a serious business. In fact, translation is a very serious business, sometimes a deadly serious business. Mistranslations in medical documents, for example, can bring tragic consequences. Literacy and cultural precision are imperative. Medical documents erroneously translated are a critical issue that can have far-reaching and tragic consequences. Accurate communication is the cornerstone of healthcare. The lives and well-being of patients depend on the precise exchange of information between healthcare professionals, patients, and medical records. However, in the realm of medicine, linguistic barriers and errors in translations pose significant risks, often resulting in tragic consequences. It's not difficult to come across some real-life cases where translation errors in medical documents led to serious harm and even death. These cases emphasize the pressing need for precision in medical interpretation and communication to ensure patient safety and optimal healthcare outcomes. The Willie Ramirez case, 1980. In 1980, a young man named Willie Ramirez was rushed to the hospital in South Florida after collapsing at home. His family, primarily Spanish speakers, informed the medical staff that he was intoxicado, a term commonly used in Spanish to describe gastrointestinal illness or food poisoning. However, the term was mistranslated as intoxicated, leading the medical team to believe that Willie's symptoms were the result of alcohol or drug intoxication rather than a potentially life-threatening condition. This inaccuracy resulted in a delayed diagnosis of a cerebral hemorrhage, causing paralysis and lifelong disability for Willie. Chemotherapy Overdose, Canada, 2008. In Canada in 2008, a bad translation of guidelines for chemotherapy drug dosages led to patients receiving doses up to 20 times higher than intended. This grievous error showcased the devastating consequences of inaccuracies in medication instructions and the critical need for meticulous translation in healthcare. The Patterson Schmidt case, USA, 1957. Patterson Schmidt, a herpetologist, was bitten by a venomous snake while collecting specimens. An erroneous rendering of the type of snakebite led to the administration of incorrect antivenom, contributing to his death. This case serves as an example of the grave consequences of a mistranslation in medical documents. The San Pedro Hospital fire, Paraguay, 2004. After a fire at San Pedro Hospital in Paraguay in 2004, incorrect translation of medical records and patient information hampered rescue efforts and led to confusion about patient identities. This resulted in incorrect treatments and delays in care, further emphasizing the need for precise communication in emergency situations. The translation error in clinical trials, USA, 2006. A translation error in the informed consent document for a clinical trial in the United States in 2006 led to severe health complications and the hospitalization of several participants. The misunderstanding impacted patients' comprehension of the risks involved in the trial, resulting in unintended harm. This case underscores the need for precise translation, especially in the context of clinical trials where informed consent is paramount. These are just some cases among several everyday situations that highlight the critical importance of accurate translation and communication in healthcare settings, not only in patient records and treatment plans, but also in safety instructions, consent forms, and all documentation related. Precision in translation is a non-negotiable aspect of patient safety and well-being. Healthcare institutions must invest in training healthcare professionals to recognize and mitigate the risks of wrongful interpretations. The translation provider retained must have a rigorous quality assurance process in place in order to identify and rectify translation errors before they reach the client and its patients. Additionally, medical equipment manufacturers must prioritize clear user interfaces and error messages to aid operators in detecting and resolving errors. Life-threatening consequences can arise from language barriers and inaccuracies in translation. The tragic outcomes experienced by patients in these cases serve as a poignant reminder of the paramount importance of precise and culturally sensitive translation in healthcare settings. To ensure the safety and well-being of patients, healthcare institutions and professionals must prioritize clear communication, rigorous quality assurance, and ongoing training in recognizing and addressing such risks. In a globalized world where multiculturalism is the norm, we all must be aware that errors in translation can have devastating consequences for patients and the healthcare system as a whole. Precision in medical translation is not a luxury. It is an ethical imperative that underpins safe, effective, and compassionate patient care. Communication is key. Access now the link in this video and find out more about your new business partner, the language access provider you can trust. Click on the link below, set a date and time available, and let's talk about how we can help you to achieve the priceless sureness that your message will reach the public unaltered and accurately. The Translation Company.